I'm the Public Information Officer with the Utah Department of Health. Thank you all for being here today for the official launch of our H1N1 public education campaign. We feel this thing is timed very well as far as the information that we need to have out there right now, and we hope the public receives it well, and we thank you for your efforts in helping to deliver the message. Today we're going to hear from Dr. Joseph Miner first. Dr. Miner is the Health Officer for the Utah County Health Department. Following Dr. Miner will be Dr. Susan Terry from the University of Utah Healthcare. She's the Medical Director from the Community Health Clinics. And then following Dr. Terry will be Dr. David Sundwall, who's the Executive Director here at the Utah Department of Health. And then we'll have the opportunity for questions and answers and one-on-one interviews following that. So, Dr. Miner.
Good afternoon. It's my pleasure to be here representing local public health departments throughout the state. As you know, it's been a real challenge. We're definitely in the midst of a major influenza outbreak, pandemic influenza, which is peaking, will be peaking soon here in Utah. Elsewhere in the nation, many parts of the country, it has peaked and is actually maybe on the way down. But for Utah, we're a little behind and seeing very widespread outbreaks here. It's particularly hitting young children, school-age children, and young adults in college ages, and I think we've all been experiencing this in our communities. We want to emphasize very much today prevention, and we'll talk a little bit later here about immunizations, but you know, primarily, we've talked about this much, but it's very important to wash hands after touching public surfaces, is the way I like to refer to it. This includes handshaking. Don't touch your face unless your hands have just been washed. You haven't maybe not heard of this, but it's almost impossible to not touch your face, your eyes, your mouth, nose. But really, flu is spread primarily by contact, touching surfaces, shaking hands, and then touching your eyes, nose, and mouth. And so it's very important to wash hands regularly after having touched public surfaces, is what I refer to it as. Of course, if ill, stay home from school or work until fever has stopped for at least 24 hours without fever-reducing medications. Healthcare workers, the advice is a little longer for that. At 7 days after the start of the fever, healthcare workers are asked to stay home just because they're higher risk of infecting other people in the healthcare setting. Cover any coughing with your sleeve, such as this, into the sleeve or into a tissue, or if necessary with a mask if you have one available. And of course, just general good care of your health with getting plenty of rest and eating a healthy diet and so forth. Those things that we learned from grade school about how to generally stay healthy. The most important tools public health has for fighting communicable disease outbreaks is immunizations. Unfortunately, we only have about a tenth of what was originally thought we might have by this time. However, the predictions or projections are encouraging for a vaccine that will be coming in the near future. And it's the charge of local health departments to distribute this vaccine, and that's been difficult because of such a shortage of the amount of vaccine available. But we as local health departments are doing this by holding mass immunization clinics to get as much vaccine out, targeting the high-risk individuals as quickly and as the vaccine becomes available. The very young children, preschool children, pregnant women, school-aged children, healthcare workers. Influenza is primarily spread by little children, small children, and healthcare workers. So they're high priority for that reason, but also pregnant women, anyone with chronic health conditions, with chronic lung disease, particularly people with asthma, chronic lung disease, heart disease, diabetes, kidney disease, liver disease, or high-risk individuals at any age, for serious complications. Fortunately, this influenza is, even though it's a pandemic influenza, is no more deadly than regular seasonal influenza, which is fortunate. However, because so many more people are becoming infected with it, that certain percent of people who suffer life-threatening complications represents a lot more people than you'd see with seasonal influenza. So it's not more deadly or complicating than seasonal influenza, but because you have so many more people infected, that represents a lot more people with those serious problems. So that it taxes the healthcare system in general. So we encourage you to be patient while we make this vaccine available. Hopefully it will be easier in the near future. And remember the basic things for prevention. I'll leave it at that.
Good afternoon. I'm Dr. Susan Terry. I'm an internist. I'm the medical director for the University of Utah Healthcare Community Clinics. And I'm here pinch hitting today for Dr. Tom Miller, who is the Chief Medical Officer for the University of Utah Healthcare Hospitals and Clinics. Dr. Miller is taking his own advice today. Stay home when you're sick. Dr. Miller has the flu. So I'm happy to be here to represent the University of Utah Healthcare. I'd like to make a couple of comments. Particularly, I'd like to address the importance of the public-private partnership that's developed. Influenza is a community problem, and we need to respond to this outbreak as a community. We know that the best way to help prevent the spread of this is some fairly simple measures, as we've just heard addressed. And these measures are included in this new Flu Fighters website that's being launched today. On behalf of healthcare providers, I'd also like to say that we very much appreciate the Public Health Service taking leadership on this issue. We know it hasn't been easy. Going from a strategic plan on paper to implementing that plan in the midst of an evolving situation is really a challenge. And this new Flu Fighters website, I think, is an excellent one-stop resource for information that will help us all in managing this outbreak. And I think it's well worth encouraging people to take a few minutes to look through this website and gather the information that's available there. The other thing I'd like to comment on is the impact of this H1N1 flu on the healthcare system. As you know, our very first priority in healthcare is to keep our patients safe. And because of that, the healthcare facilities across the state have banded together and created guidelines for visiting our patients. And we really need the public to help us enforce these statewide visitor guidelines at all hospitals. And these include the following. We're asking that no visitors under 14 come to the hospital. We want to protect patients and we want to protect the children themselves. We also ask that no more than 2 visitors at a time visit any one patient. Of course, if you're sick, don't come to the hospital. That's the worst possible place for you and for the patients in the hospital. We need to remind people to wash their hands frequently and use hand sanitizer, particularly after shaking hands or touching any surface that could be contaminated. If you must cough or sneeze, cover that cough or sneeze in your elbow or with a tissue, which you then dispose of and then wash your hands. And if you're visiting the emergency room, please limit the number of people you bring with you. Hopefully just one family member for transportation would be enough. It's really important to leave the rest of the family at home.